Under the Democratic plan, there's a $6,000 deductible. Imagine the housewife who has to take her child into the urgent care center and knows she doesn't have the money. This is a cartoon, but in that cartoon, there's real stress and anxiety for that mama who cannot afford the care she knows her daughter needs. Look at this one, the Republican plan. She's got money in her pocket. She's got money in her account. She's got money in her pocket for the insurance out of pocket. And if she starts off with money in her purse to pay for that need, why can't people see that's where the American people are? If the average American family has less than $1,000 to spend, and our plan puts thousands in their account to pay for the health care they know they need, what is the objection to that?
The Republican plan on offer is snake oil in a gaping wound. It's going to spark an avalanche of junk insurance plans designed to enrich big insurance companies, a puny savings account to cover the cost of an appendectomy, having a baby, or getting your tonsils out under the Republican plan is going to leave patients up to their eyeballs in financial debt. The biggest winner under this Republican scheme won't be Bartley and Carla of Eugene, Oregon, whose premiums will skyrocket by 500% on January 1. The real winner under the Republican proposal will be big insurance, specifically the biggest, United Health Group.
On this vote, the yeas are 51, the nays are 48. 3/5 of the Senate's daily chosen. 3/5 of the senators duly chosen and sworn. Not having voted in the affirmative, the motion is not agreed to.
Democrats know that Obamacare has failed. They themselves have said so on this floor. But with a deadline quickly approaching again, a deadline that was set by my own Democrat colleagues, they say we have no choice but to extend this failed policy one more time on these premium tax credits. This is a policy they could not even make permanent when they controlled the presidency, the Senate, and the House. Even so, their only offer is more spending.
Make no mistake, today's health care vote is more than a vote on a single bill. In a greater sense, in the fight to make American life more affordable, in the effort to save the American people from a looming health care calamity, the majority of this body, the majority in the House, and above all, the President himself, are, in short, choosing to abstain. They are throwing up their hands, essentially saying, nothing we can do here. Given the choice between keeping health care premiums from skyrocketing for millions of Americans or letting these tax cuts expire, the President is content to do nothing. In the face of this health care crisis, in the face of Americans of all political stripes clamoring for a solution, the Republican majority is deciding that the world's greatest deliberative body ought to shrug its shoulders and abdicate its responsibility. So yes, I'll close with this. It's a bad day for this country and for the United States Senate. And it's a day that the American people will remember. Thank you, Mr. President. I yield the floor.
On this vote, the yeas are 51, the nays are 48. 3/5 of the senators duly chosen and sworn, not having voted in the affirmative, the motion is not agreed to.